Welcome to Dr. Healthy Habits channel. In this video, I will tell you many interesting facts. Itching is an unpleasant skin sensation that induces a desire to scratch. It can be physiological, in response to adequate irritants, like insect bites, or pathological, in response to stimuli under altered nervous system reactivity. Skin itching associated with liver diseases falls into the second type. It was long believed that itching occurs when stimuli are too weak to trigger a pain receptor response. However, it's now known that free nerve endings, not part of pain receptors, act as itch receptors. Talking about the pure origin of skin itching in liver diseases is quite complex, as it often starts well before other symptoms. Furthermore, itching itself rarely becomes a reason to consult a doctor. If the patient does visit a specialist, it is usually a dermatologist rather than a gastroenterologist. Therefore, treating itching caused by liver pathology can be long and unsuccessful until the symptoms of the underlying disease become evident. It is considered that itching is present in 100% of patients with primary biliary cirrhosis and approximately 15% of patients with viral hepatitis. Causes of skin itching. Itching is the main and most common manifestation of cholestasis. This condition occurs when bile stagnates in the ducts due to various reasons, preventing it from entering the intestinal lumen. Intrahepatic cholestasis usually develops due to impaired bile formation and transport in hepatocytes or due to damage to intrahepatic bile ducts. Extrahepatic cholestasis occurs when there is a disruption in the patency of extrahepatic bile ducts due to a tumor or gallstones. Thus, the development of cholestasis can be caused by viral hepatitis, drug-induced hepatitis, liver cirrhosis, pregnancy, gallstone disease, congenital or acquired deformation of the bile ducts. Why cholestasis causes active skin itching has not been precisely established, but there are several hypotheses. According to the first version, skin receptors are irritated by an excess of bile acids in the blood. Studies have shown that in healthy individuals, itching occurs after the introduction of bile acids into the skin. However, many patients with pronounced cholestasis do not have this symptom. Why? This question remains unanswered. There is a version that suggests that with cholestasis, along with bile acids, other substances that cause itching also enter the blood. For example, the autotoxin enzyme involved in phospholipid metabolism in liver cells. Perhaps the influence of other biologically active substances such as histamine and cytokines. There is another assumption that excessive endogenous opioid peptides synthesized within the body cause skin itching. The liver directly participates in the removal of their derivatives from the body, so when its function is disrupted, the concentration of these substances in the blood increases, resulting in itching. More often than not, skin itching in liver diseases starts from the limbs, palms, soles, and the spaces between the fingers. It is usually weaker during the day and intensifies at night, hindering sleep, which can eventually lead a person to complete nervous exhaustion. As the liver disease progresses, the itching spreads to the entire skin surface. A patient may injure the skin with intense scratching. If pathogenic microbes enter the wounds, suppuration and other manifestations of skin infection appear. As the liver disease develops, other symptoms join the itching: jaundice, telangiectasia, spider veins, xanthomas, xanthelasmus, subcutaneous cholesterol deposits, and palmar erythema. Itching in liver diseases usually begins 2 to 3 years before jaundice and does not go away on its own until the late stages of liver cirrhosis. Therefore, spontaneous disappearance of this symptom without treatment is considered an unfavorable prognostic sign. Itching is diagnosed based on the patient's complaints and characteristic abrasions, often with crusts or inflammatory changes. To identify the causes of itching, the doctor may recommend a comprehensive examination. A complete blood count can detect anemia that occurs with a serious impairment of liver function. Blood clotting factors are synthesized in the liver, so a malfunction is possible in case of illness. Biochemical blood analysis can reveal an increase in the level of liver enzymes, transaminases, alkaline phosphatase, gamma-glutamyl transpeptidase, bilirubin, a decrease in the level of protein in the blood serum, and a change in the ratio of protein fractions, as well as an increase in cholesterol. Treatment. First of all, the patient is recommended therapy aimed at eliminating the underlying disease. To reduce skin itching, the doctor may prescribe ursodeoxycholic acid preparations. You can avoid itching if you prevent the development of liver disease. For this, you need to eat a balanced diet, maintain a normal weight, observe hygiene rules, give the body moderate physical activity, and not abuse alcohol. By the way, friends, write in the comments, how do you lead a healthy lifestyle or plan to start? Share, it will be interesting to know your opinion. And if you liked this video, then like it and subscribe to the channel. See you in my other videos. Goodbye.